Hello everybody, I'm Namita Thapar, Executive Director of MCure Pharmaceuticals, and today's episode is going to cover a topic that every single person wants to know more about: heart attack. One of the most prevalent conditions. In India alone, 3 million people have heart attacks every single year, and as we can all believe, it is underreported, and I'm sure the prevalence rates are much higher. To delve deeper into what exactly are the various aspects of a heart attack, we have a legend with us, Dr. Mehta. It's a privilege and an honor to have you with us today, sir.
Namita, thank you very much for having me with you. Let me tell you, I divide the risk factors, we call it risk factors, in two groups: correctable and non-correctable. Now let me say non-correctable. What is non-correctable? Let's say, Namita, a man comes or a patient comes to me. Why say man? Anybody, man, woman, comes to me and has a strong background of family history. You don't have right to select your parents. So family history is a not correctable factor.
Right.
And the second thing is aging. As you grow, the age increases. So heart disease is age-related disease.
Right.
For example, arthritis, cataract, prostate in man, those are all age-related diseases. Some are wear and tear. Similarly, aging also, the heart attack is one of the aging processes.
Correct.
So these two are not correctable. But there are many correctable, and if you pay proper attention, you can postpone the heart. After all, you know, why am I using the word postpone? We all are mortals. We are finite, not infinite. So the risk factors are hypertension, diabetes, high level of cholesterol, obesity, stress, very important factor,
Right.
and so on and so forth. So these are, and smoking, of course.
Absolutely.
Yeah, smoking, of course. Now, these are correctable. Now, just to give you an example, if you smoke one cigarette, you reduce your life by 13 minutes.
Oof. That's a great statistic to keep in mind.
And the smokers live shorter life. And apart from, of course, the various other damages that they make by smoking is that lung cancer, tongue cancer, so on and so forth.
We see a lot of young people, more and more these days, having heart conditions. What is the cause? And especially seemingly fit people who take good care of themselves. That is the part that is shocking and I'd like to talk about.
Approximately 1 out of 10 individual heart patient is below the age of 40.
Yeah, my God,
So
that's a huge statistic.
it's now, the 40 is that age where the man reaches zenith of his career. And then onwards. And he's a breadwinner of the family.
Absolutely.
So it comes as a real root shock. Those people who have a mild block, let me elaborate what block means. When we have over a period of time deposits of fats and cholesterol on the inner lining of our heart's arteries. And usually they may grow slowly and slowly over a period of time. And when they grow up to the level of 70% of the lumen of the artery, somehow the defense mechanisms of the body help to maintain still an adequate flow. A 70% blocked artery or less blocked artery can manage the blood supply adequately, both at rest and on demand.
Right.
So that patient doesn't find a need to go to a doctor.
Right.
And even doctor performs certain tests, may find that they are normal. Now imagine, this is enigmatic. Namita, this is really enigmatic. Why? Because neither you have symptoms, nor by ancillary investigations or non-invasive investigations like stress test and these and that and blah, blah, I can't find it. With these two things, he lives normal life And suddenly, for some internal stress, that block, which was 30-40% only, ruptures.
Oh.
From internal stress or external stress.
Okay.
Let's say a bout of hypertension or a bout of stress and release of adrenaline.
Right.
So the repair phenomenon starts.
Right.
So the platelets and the blood elements, they go there.
Right.
And starts the process of clotting.
Right.
Wherever there is an injury, the phenomenon clotting starts. And what is 30%, within a matter of few hours, can become 90 or even 100.
Oh my God, okay.
And when it becomes
So
100...
that's why you're saying it's not detected because it's at 20, 30, which is acceptable, but it can go from 30 to 90 with this sudden spike in hypertension, you said, and
internal stress,
sudden
adrenaline,
internal stress, adrenaline rush.
Yeah.
But it doesn't happen to everybody who has a stress.
I'm coming to that too. Now, so the plaques are of two types. Soft plaques rupture. The hard plaques don't rupture.
Okay.
And so then, if I can't detect and if I can't pick up, the patients don't have symptoms, so what do I do?
Right.
Yes, it's an enigmatic problem, but I would believe that those people who are at a higher risk. What do I mean by people who are at a higher risk? People who have diabetes, smoking, people who have smoking, family history, people who have diabetes, obesity, hypertension. So I weed them out and said these are high risk patients. I must watch them closely.
Right.
Then I prescribe those medications which can at least make that soft plaque harder.
Understood.
So at least it doesn't rupture very easily.
Understood.
And there are medications like cholesterol reducing medications and stress management, hypertension management that will help us to bring the incidence of sudden heart attack down, if not eliminate completely.
I want to talk about some of the myths that exist around heart attack, whether they're right or wrong. So one of them, always I hear people saying that, oh, she used to over-work out and sometimes over-exercise at a certain age, whether it is training for a marathon or over-weight lifting, caused the spike in the hypertension that then led to the rupture of the soft,
because
plaque. Is that a myth or is it true?
Both.
Oh my God, that doesn't give an answer.
Both. Like I'll tell you what. Maybe I, to quote an example, might not be knowing that am I carrying soft plaques or not. Mm-hmm. And then I go to the gym and then I enter into a competitive sport where I over-exercise.
Right.
And at that point of time, what happens is that when you do sudden over-exercise, two things happen. Sudden rise in pulse rate and sudden rise in your blood pressure.
Right.
And the product of pulse rate and the blood pressure is the stress on the heart.
Correct.
And heart wall and heart muscles and as well as the artery. That time the plaque may rupture.
Got it.
And he doesn't know that he was carrying a soft plaque. And then this comes. It's fortunately, sudden cardiac death is not that common.
Okay.
But when it comes so suddenly, and since it comes in a comparatively young age, it comes as a real rude shock.
Absolutely.
Yeah. If the patient presents to the hospital after the onset of heart attack within 1 hour, which now we have labeled as golden hour.
Correct.
Then the survival from the heart attack is highest.
Absolutely.
So much so that if you treat the patient within 1 hour of the onset of heart attack, at the end of 3 months, there is no trace of heart attack. The heart returns to normal level completely.
Oh, wow. Fantastic.
That I think is very important for durability of life.
Right. You can have life expectancy like any other.
Correct. The life expectancy, that's a correct word. And second thing, care of heart should start early enough. When I was doing research in United States, I was investigating a closed-door population, that is the school-going kids. 16% of the school-going kids in our study had cholesterol level of more than 300.
My God.
Whereas
Junk food.
Whereas the high level is 200 and above. 300, and these children did not know. Many times people are embarrassed that you go to the hospital with a pain and doctor dismisses, this is non-cardiac, go back. And you feel embarrassed that I troubled everybody. In the middle of the night, I scared everybody.
So next time it
And
happens, you don't do it.
This was crying wolf. I would say to those people who are scared of crying wolf, cry wolf, please.
Yeah.
Cry wolf as many times as you want to.
Yeah.
But I don't want to miss a single heart attack.
Let's quickly talk about the test that she mentioned. So even for people who are at high risk or not at high risk, when we go for our annual checkups, right, which are the must-do tests?
You must get your complete blood check biochemistry, which includes all kinds of cholesterol, low density, high density cholesterol, triglycerides, total cholesterol. That's one.
Correct.
Sometimes some minor tests, minor risk factors, homocysteine and so on. That's one part. The second, preferably in the male patients who's active, stress test is useful to
Right.
pick up early.
Right.
And other thing is, of late, I think, and it's gaining importance, is a CT coronary angiography.
Okay.
Computerized angiography with high resolution is non-invasive test where the patient is given certain amount of contrast medium in the IV route through
Right.
intravenously,
Right.
and then is exposed to scan,
Okay.
computerized scan, and that outlines the coronary arteries like as they would do it in a regular invasive angiography.
Right.
And it could be a good pilot study.
Okay.
I would say it's good and useful.
Okay.
So this will help us to pick up disease early and before any damage can happen. 65 to 75% of the patients who get admitted to ICU have expressed that is the first time in their life they were ever experienced chest pain.
Okay.
That means they did not get background warning.
Right.
Or if they got it, they were so mild that they
missed
probably
it.
ignored
They
it.
probably missed it
Yeah.
too. Yeah.
So
yeah.
this kind of testing will be helpful.
Absolutely. You know, that's so beautifully said. And I think it's a great segue since we're talking about scare and care to our two wonderful women here. Let's hear your stories. Kashmira, let's start with you.
Okay. I was having a severe jaw pain. That is the indicator. That was 13 years ago I started.
How
the
old
very-
were you at that
I
time?
was 48.
very
And
young.
I have a family history of cardiac attacks, you know. My father, he expired in the first major attack. He was just talking
How
to
old
us.
was he when-
He was 48.
Oh my God.
And I had my first experience at 48.
Just the jaw pain
The
is
jaw
what?
pain was the only indicator. So I rushed to doctor. I've known doctor since the past 3 decades. He's been a family cardiologist. He's treated my family members as
So
well.
you made it in the golden hour.
Yes, yes. And
Doc, jaw
doc-
pain? No, I've never heard of jaw pain being an indication.
No. Yeah. So that leads us to another question, the presentation of heart attack. How does one know that this is the time I must rush to doctor immediately? It is a myth. You asked me about myth, now let me
Yeah,
tell you
yeah.
myth. That heart attack occurs on the left side of the chest because the heart is situated on the left side? No. That the heart attack must be severe pain? No. That the heart attack has to be presenting in a massive way that you fall, oh my God. No. It could be a mild discomfort in the chest, or it may give you a sense of indigestion, or might be a discomfort which radiates to the lower jaw, or sometimes to the both shoulders or both arms or upper abdomen. So my plea that if you are in that age group between say 45 and 60, and if you have any discomfort on any part of the trunk,
Correct.
it is better to err on the safer side and rush to a doctor.
That's very good to know. So that solves the jaw mystery for me. And you rushed to him within the golden hour?
Yes. And he immediately an emergency. He put stents, and at the same time, I have stents in my kidney as well.
Okay.
Yeah, There was not sufficient blood supply to the kidneys.
Okay. A lot of times we hear stents have to be replaced within 3, 5, 10 years. What's the story around that? What is the average age or lifespan after which you would need to do a re-surgery?
When I place a stent, with the current technology, with the modern stents, there is a recurrence within the stent in approximately 6 to 8% of the cases within 1 year.
Within 1 year. Okay.
But if nothing happens in the first year, then it's very, very small chance
That you will have to
that the same stent will create a problem again for you.
Understood.
That's rare.
So it's a myth that if you have a stent, you'll at some point have to keep getting it replaced. That's not true.
No, that's
Got it.
not true.
Got it. That's really good to know. Sorry, Kashmira, please go ahead.
And the next year, I again had a restenosis. That same stent, was filled up with plaque
What we
again.
just
Yes, we
discussed.
just discussed.
She was unlucky
Yes.
6% one.
Yes.
That's a small percentage that you fell in.
Yes.
And then you
So
had some
it was
symptoms when...
The same thing.
The
I
same
always
jawline.
have, the same jaw pain.
Okay. And then again, you were smart
But the
enough
second
to...
stent lasted for benefits for longer period.
Yes, for 6 years.
6 years.
6 years. In 2018, again the same symptoms. I had 2 more stents again.
And now, for patients like her, you make sure that they come for a checkup of blockage and just a scan every 6 months, 1 year. What's the duration?
Yes. Now we call them every 6 months.
Every 6 months.
Yes.
So just to make sure everything's okay. So it's more preventive rather than waiting for the pain to occur again.
Right.
Right.
So we pick up early.
So
True.
that's a very important message, Kashmira, from you that, if you're vigilant and if you go to the expert at the right time, you can prevent a heart attack.
Yes.
That's fantastic.
I trust doctor implicitly and follow whatever he tells me.
That's important. Having that trust with your healthcare practitioner is
Trust him
extremely
with my
critical.
life.
Super. Pragya, let's hear about you. What happened in your case?
I always practice yoga and meditation and always into the health conscious and always take care of my health and diet and everything. Very fine, everything was going smoothly. But during COVID time, I felt like I was having a severe acidity, especially at night.
Okay.
After the dinner. And it was continuously for 1 month or 2 months around, and then I was taking care of having some medicine or Eno or home remedies, and I was feeling all right. Then I visited our family doctor, and he has advised for some tests like TMT test, the treadmill stress test, and 2D echo, and there it is as positive.
Okay.
And I could not believe that something will happen to me. I just said this is something wrong, maybe the taste is not correct. So then just ignored it for 6 months. Then after 6 months I visited a hospital for angiography.
Correct.
And there only they can say the correct picture, whether I'm having some problem in the heart or there is no problem.
Right.
And there they said there is a blockage.
Okay.
And again I said, no, nothing can happen to me. I am very fit and
denial.
fine. Yeah, the denial. And actually I was not having any symptom. I was not finding that I am having some problem other than that acidity. Then I visited many hospitals to many doctors, but could not convince myself that yes, I have to go for angioplasty, because the same day doctor said you go for angioplasty the same day itself.
Right.
You, in that the cath lab, you have to go for this and you have this much blockage. So then somebody advised Dr. Mehta, and it was after 6 months of struggling whether to go for or not to go for. The moment I saw Dr. Mehta, some kind of that belief or the trust or that something was there, he said, day after tomorrow is the operation. I said, yes, doctor. Day after tomorrow will be the operation.
But in her case,
No
it
damage
took
happened.
almost 6 months between her having the symptoms and then going to a doctor and then being in denial after all the tests. She lost 6 months. How do we know whether that loss of time, I mean, probably the blockage wasn't as much. Is that the reason why the 6 months
wasn't
didn't
progressing.
lead to a heart
It
attack?
was not progressing very rapidly. It was a slow progression.
How do we know when it's going to be rapid versus slow?
All right, good question. If any patient who has symptoms like when I walk about 15 minutes, I get discomfort in the chest. But doctor I've noticed for the last 1 month, what was happening in 15 minutes has started happening in 5 minutes.
Right.
And now, formerly I used to take sometimes sorbitrate under my tongue, and I used to get relief within 2 or 3 minutes. Now it's taking 15 minutes.
Got it.
Or formerly it used to happen once in a day. Now it is happening 5 times in a day. Then I know this is progressing.
Got it.
Then
so
I
you look
show
for those
then
indications.
then I show expediousness. They will have to do it little quickly.
Yes.
Doctor, we spoke about so many facets of heart attacks, prevention, treatment, everything, myths. Is there anything, any parting words, anything we've not covered that you'd like to end this beautiful session with?
Yes. And that is, I think, our government should give more importance to healthcare.
Yeah.
Many countries are giving far more importance to healthcare, and our government will take a note of it. Just to cite an example, today a college-going boy or even a high school boy spends 2.5 hours in front of a fluorescent screen, be it a video game, be it a TV, or be it a mobile phone, instead of spending time on a football ground. And all right, the government should also take a note that the football grounds are fast disappearing. And we'll have to have a proportion. Like, in my opinion, when we say the community should have a school, a movie house, a club, and a sports ground. That makes community complete. That's my message to the caretakers of our country.
How beautifully said.
yes.
How beautifully said. And there can be no better way to end this fantastic episode. The burden of heart attacks is getting enormous in our country. And again, our legend, Dr. Mehta, has dissected it so beautifully and in such layman terms. But the important takeaway is get your tests done on time. Especially if you're a high-risk patient, even if you're not a high-risk patient, understand the symptoms well, rush in the golden hour, do not be in denial, and get the right procedures done so you can prevent the heart attack. This is again a message to get educated, to get the right test done at the right time, and take charge of your health. Thank you so much.
तकदीर अपनी उजली ढूंढने है वो निकली तकदीर अपनी उजली इल्ली ने मन में ठाना है बन के